Breastfeeding Week is celebrated on 1st to 7th August. For the year 2021, the theme for the World Breastfeeding Week is Protect Breastfeeding, a Shared Responsibility. The best source of nourishing the infants and young children is breastfeeding. The World Breastfeeding Week aims to highlight the huge benefits of breastfeeding on health and welfare of infants and young children. Nearly 1 lakh children die every year in India due to diseases that could have been prevented through early initiation of breastfeeding. In India, it is estimated that 99,499 children die each year as a result of diarrhea and pneumonia that could have been prevented through early initiation of breastfeeding along with proper colostrum feeding practices and exclusive breastfeeding for the first 6 months. According to UN report, the mortality and other losses due to inadequate breastfeeding can cost the country's economy of $14 billion. At last, I would like to say breastfeeding gives babies the best possible start in life. It is one of the most effective and cost-effective way to prevent infant mortality and morbidity. We nurses are frontline workers. Let us share our responsibility in promoting breastfeeding for infants and young children and improve the health of babies around the world. Thank you.
Every year, we celebrate the World Breastfeeding Week from August 1st to 7th. This year, the theme is Protecting Breastfeeding, a Shared Responsibility. We have to protect breastfeeding from the marketing influences. In other words, we already have a law in the country which is called as Infant Milk Substitute, Infant Food and Feeding Bottles Act. This law was enacted in the Indian Parliament in 1992 and amended in 2003, which takes into cognizance the promotion of all this infant milk, baby food and feeding bottles even through the social media. So this year's theme is that we have to protect breastfeeding from these baby food manufacturing industries. In addition, we have an added responsibility of protecting breastfeeding in women who are suspect COVID or who have turned positive to COVID. I would like to reiterate that even a COVID positive mother should breastfeed like any other mother, but with precautions. When she is breastfeeding, she should wear a mask and she should wash her hands. Baby should be kept in the same room at a distance of 2 feet, and the mother needs a person to help her to get the baby. So, even in the circumstances of COVID, breastfeeding should continue. These precautions are to be followed for 14 days only when the mother is likely to infect the baby. So hence, even during COVID pandemic, pregnant women and lactating mothers who are turned positive to COVID should breastfeed with the precautions for the 14 days only, because after 14 days she is no longer infective. Thank you.
This year, 2021, the theme is Protect Breastfeeding, a Shared Responsibility. What is that to share? To whom to share is, first of all, the individual has to be shared the responsibility. The antenatal mother should be educated and prepared. And next is the couple, to be father and mother, should be given this education to them, and family members, especially the in-laws, and because there will be taboos and cultural backgrounds, myths also will be there. Once if we give the education, this responsibility can be able to go through, and next is through the society and to the whole world. Now I'm going to speak about problem and management. What are the problems usually? Sore nipple, cracked nipple, small breast, big breast, and the small nipple, big nipple. These are the doubts mothers will be having whether I can able to feed. Next, the engorgement, full breast, and it can able to lead to mastitis also. First of all, why the sore nipple will come? Usually the sore nipple can able to happen. Just give the education to everybody. For an example, this is the tongue. Tongue has soft zone and hard zone. And once the nipple is going on the tongue, the nipple cracks will happen. When it is going to the hard zone, the nipple tips will get the pain and pimple-like thing which is collected the sore. And when it is going to the hard zone behind is the hard zone, the ejection of the milk will be very good. Treatment for the sore nipple and cracked nipple is fix the baby proper position attachment. As the baby suckles, the sore and cracks can be healed on its own. If it is a big breast or small breast, it's no harm because the ducts are same in whether it's big breast or small breast. If the nipple is very big, when the nipple goes inside, it will form a teat. And once the teat is formed, the baby can able to really go that the nipple will not be. Please remember, baby's mouth will be small, but the nipple will be inside one lemon can able to go inside. And always when the position attachment is there, see that there are so many positions, whichever mother and baby is comfortable, that position they can able to go. Look at my hand. This is only a cradle position I'm showing. Mother's baby's tummy and tummy. The cheek should be touched to the baby well. This position can able to be baby very comfortable. Mother also will be very comfortable. Whichever position a mother is comfortable with the baby, she can able to go. Now what to do if it is a baby is having the engorgement? Most of the time when the mother is feeding, see that the hand is nicely pressed. See, touch and see on the breast. Anywhere, any lumps. Take your 3 fingers, mild massage and start feeding the baby. The engorgement or the abscess will not take place. Even the mastitis can able to be prevented. So this is very informative to many people. Everyone responsibility to spread this responsibility to manage the problem. Thank you.
It's a pleasure and honor for me to address you all on the eve of the World Breastfeeding Week 2021. Breastfeeding is part and parcel of nursing care. Today's generation need complete lactation support from nursing service. So, as all of you know, every year we celebrate World Breastfeeding Week in the month of August 1st to 7th. WHO, UNICEF come out with every year beautiful theme on breastfeeding. This year theme is Protect Breastfeeding, a Shared Responsibility. So it's a beautiful theme. It is breastfeeding is not just a mother and baby journey. Here the healthcare workers actually start an important role for the child and the mother to start the journey of breastfeeding. So here I wanted to give 2 points which you will not forget when you join your service in the hospital. So the number 1, if you are happen to work at the maternity service, the moment baby is born, initiate breastfeed within 1 hour. Irrespective of mother has gone through painful labor, prolonged labor, or cesarean delivery or normal delivery, the baby should be brought into the mother's breast as early as possible, within an hour. The next thing is the baby should be given uninterrupted skin-to-skin contact for that hour. This would help the baby not get into hypoglycemia, hypothermia, and hospital-acquired infections. And with this of bonding, mother and baby will feel quite happy, and the baby is calm. Obviously, mother is also calm. So here, I would encourage you all to participate in the first journey of new arrival of newborn to this world. you and me help in this journey, starting journey, the next step would be helped by other healthcare workers, and we can train the parents to continue this journey for 6 months to 2 years. So thank you, boys and girls. Happy breastfeeding week. Bye.